I think we'll go ahead and get started. I just want to thank everybody who's here now, both online and in person, especially with the proximity to the holiday. We're really grateful that you guys came. So this is part 4 of our our 7-part series from Chris and the Accords Education Program on how to successfully obtain funding from PCORI, Patient-Centered Outcomes Research Institute. Each of these workshops or seminars has highlighted a unique aspect of the funding process. So if you've missed any of these, they're available online now on our website. We're kind of having a group, but today we've got a mixed panel. We've also had some lectures, small group discussions, things like that. And then in April, we're going to be culminating with a big conference. So check our website for information about that. Typically, these workshops have been geared toward junior and senior faculty who are interested in applying for PCORI funding. But we're excited that over the last few seminars in particular, our audience has kind of broadened. So please do be sharing these announcements with anybody you think might be interested. It's kind of exciting. We've simulcast even outside of the state recently. So it's pretty interesting. And please sign up at the table outside if you haven't already given us your email and you want to be included on our announcements. So today's talk is going to explore the topic of PCORI Community Engagement Pipeline Awards. We're fortunate to have 2 panelists here with us today. Sara Mazzoni, I'm going to introduce first. Foremost is a physician in obstetrics and gynecology at Denver Health. Here at UC Denver, where incidentally she received her MPH and also completed her residency, she is an assistant professor. And now among her other various research and clinical responsibilities, she's also a co-chair on Panel C for October. She has an interest in public health program implementation and evaluation, and specifically in pregnancy. And she says her greatest passion is her children, Gabriel and Alexander, ages 5 and 3. Sarah Brewer, who's also a new mom, is joining us today. She's a senior professional research assistant with Accords and PBRN manager for the CocoNet Pediatric Practice-Based Research Network. She has been working on practice-based outcomes research projects here at the University of Colorado for the last 4 years. She brings experience with community engagement and community-based research. And before her time here, she spent about 7 years at the University of Denver Center for Community Engagement and Service Learning, where she managed community engagement programs for faculty and students trained and supported faculty and community partners conducting community-based participatory research. She's currently a project manager and qualitative lead for the PCORI Eugene Washington Engagement Award, which aims to develop stakeholder-driven research, a stakeholder-driven research agenda with statewide CocoNet PBRN. So we're very fortunate to have both of them here. I hope you'll join me in welcoming them.
Thanks. So Sarah and I talked about making this relatively informal, so we're going to talk a little bit about the 2 different funding mechanisms and our experience with them, and then we're hoping to open it up to Q&A and hear from you guys what questions you really have, so that this will be a little more interactive. So I'm going to start, before I jump into the Eugene Washington Engagement Awards, a little bit about how PCORI thinks about engagement. I think as researchers we often think about it one way, and PCORI thinks about it in a much more robust way. So first they're thinking about a pretty broad variety of stakeholders, and a lot of the things I'm pulling you can find on their website as well, but I found them really helpful in just thinking about where they're coming from. So they're thinking about a number of stakeholder communities. So they might be patient-centered outcomes research, but they're thinking about stakeholders much more broadly. So including the patients and consumers, but also caregivers and family members, guardians, so people who are engaging with that patient throughout the healthcare process. Thinking about advocacy organizations, researchers, clinicians, so really thinking about that broad spectrum, including people like purchasers and payers, who we often don't think about when we're thinking about health outcomes research, industry policymakers, training institutions. So when we were thinking about our engagement award and our PBRN, we're thinking not just about the patients at those practices or the clinicians who run those practices, but we're thinking about the public health institutions that also interact with those patients. We're thinking about the payers who pay for the care and how their role impacts some of those outcomes or health issues that are coming up. We're thinking about other researchers, so not just those of us who applied for the grant and are engaged in that project, but other researchers here at the university and other universities. So just, I think, paying attention to a broader spectrum than what we typically do in our grant applications. And then the other thing that PCORI is thinking about are sort of underserved populations. They have a pretty long list of underserved populations of interest. So some particular focus there. And then when they're thinking about engagement, they're not just thinking about, I was talking to somebody about these awards last week, and they were like, so I could just do some focus groups, right? And they're thinking much more broadly than that. They really want to engage all of those stakeholders that they're talking about in all of the parts of the process. So everything from conception of a research question, designing the project, all the way to dissemination after you have results. And they think about these with a couple of different, they call them principles. And again, these are pulled straight from PCORI. So they're thinking about reciprocal relationships. And from a community engagement perspective, that's really thinking about, great, I can engage patients or other stakeholders in my research. I'm gaining a lot of their insights, but how am I also giving back to that community? And what is that give and take between the researchers and all of the people they're engaging with? Which sort of goes also to the co-learning. So you're learning from the community as well as providing information back to the community. So there's reciprocal relationships, but also reciprocal learning. And then they're thinking about partnerships. So like I said, they really are thinking about how do you engage all of the stakeholders throughout the whole process. So how can you bring in patients as partners in your research? And these are all pretty standard community engagement principles as well. But so when you go do, for example, phase one of our Eugene Washington Engagement Award is interviewing stakeholders from across the state. So when I'm doing those interviews, I'm not just looking to get information from those people. I'm looking to build these relationships. I'm looking to learn from and teach the people I'm interviewing. But I'm also looking at how can I partner with these people? Are these people who have characteristics where I can bring them in as partners and have them help design the next phase of our research beyond just that interview or a focus group with those people? And then PCORI is also really focused on these principles of transparency, honesty, and trust. So a lot of that is just about treating the people you're partnering with as equals, bringing them into your project team, engaging them in all of those pieces of the process, being honest with them about, for example, the challenges and of doing research versus doing community programs. So really having a give and take and discussing challenges with them, coming up with solutions together throughout the process. So they're particularly thinking about engaging in research. So we're not just engaging them to come up with programs or to have, nice dinners together, make friends. You're looking to engage all of those stakeholders in research. So this sort of comes back to the last slide. How can you make those stakeholders research partners? How can you engage them in that research process? And then how is that engagement with the community meaningful to your research? So again, you're not just going out and doing an interview or you're not just recruiting community members to become part of your patient advisory board so that you can fill seats. You're really looking for a meaningful partnership in the process. And I put this link up here. I think it's useful to think about as you're putting together an application for one of these mechanisms, they have an engagement rubric that helps sort of check the boxes. Are you thinking about these different things as you apply? But the sort of heart of it is, how can you make this meaningful for both you and your community to really be a reciprocal partnership? So they have a couple of different mechanisms. There's the Pipeline to Proposal Awards, which Sara Mazzoni will talk about in a couple minutes. And then there are the Eugene Washington Awards, which are split into research, meeting, and conference support, and the Knowledge, Training, and Development and Dissemination Awards. So we're going to talk about these two. I can't speak very much to the research, meeting, and conference support mechanism, but I've got a fair amount of experience with the other Eugene Washington Awards. So Sarah, I'll let you come back to those later. So the Eugene Washington Awards, these are sort of the quick and dirty. They're up to $250,000 over 2 years. And then in terms of just upcoming deadlines, February 1st is a letter of intent deadline. And then if you're asked to complete a full application, those are due 40 days later. And then these are really designed to support PCORI's goals of developing patient-centered outcomes research community. So really focused on creating a group of people who are ready to participate in PCOR projects. They're focused on engaging the community in the research process. So like we talked about, all of those phases from conception to dissemination, engaging the community. And they have a goal of promoting dissemination and implementation. So taking whatever we learn, implementing it, or sharing it with the community, using those community partners that you've built through engagement. So like I mentioned, there are 3 different sort of categories under these Eugene Washington Awards. There's the Knowledge Awards, and I think about these as helping to share the knowledge about your health topic, as well as helping to develop knowledge of research and community engaged research with your community partners. So I'll jump to, like Chase mentioned, we have a Eugene Washington Award, and we are developing a research agenda with our practice-based research network. I'm doing a lot of interviews. I'm talking to all of our stakeholders throughout the state. And we're really trying to get at this second bullet point here of understanding where the gaps are, understanding what questions people have, but also sharing that back with the community and asking them to help develop research around the questions that they have. So this is really a knowledge example. Then they also have what they call Training and Development Awards, or a category within these awards. And these are really focused on that development of community who are ready to participate in PCOR research. So training them on community-based research principles, training them on things about the research process. So often when we involve community members in research, it can be really challenging to mesh our worldviews. They are often coming at things like, let's solve the problem, can we do a program? And we as researchers are often coming at things from, we need a question and a protocol, and it needs to work this way. And so really getting everybody on the same page and helping those stakeholders who aren't typical researchers to be able to work within that process. So to bring their perspectives, but also to have this training around research and what that looks like. Then they have dissemination awards, and these are really focused on sort of that end portion of the research process and using community members to help disseminate and implement your results. So that can be, an example would be having your community partners help co-present your results back to their community. So at a community meetings with the community partners you've worked with, but really working with those community partners to disseminate it. So it's not just going to a journal and getting published and sending out that publication. It's really meeting with your community and discussing those results and sharing them back. I think that's it there. So when you're thinking about the Eugene Washington Awards, a large portion of the application looks very similar to any other grant application. You've got your methods and your partners, and so, but one of the pieces that's very different that I want to focus on is the patient and stakeholder engagement plan. So this is the piece where you're really describing to PCORI that you plan to engage community and stakeholders in that meaningful way I was talking about. So that this is your way to sort of showcase that to them and explain how you're going to get that meaningful participation from community stakeholders. So I think for us, and I'm trying to give these examples because I think they're helpful, but hopefully you think so too. For us, in our Eugene Washington Award, our stakeholder engagement plan really outlined different levels of engagement that people could participate in. So they might only participate in an interview, and that's sort of level 1 engagement. But then we're also doing some working groups, and that's sort of level 2. If they engaged in that interview, they felt really strongly about one of the issues that came up in our project, then they could sort of move to level 2 and engage at a different level and really help develop a research question and some aims around that. Level 3, they can move into our network advisory board and really help move the whole practice-based research network forward, in addition to some research question development. So really explaining how you're going to get meaningful engagement is something that PCORI is looking for here. That it's not sort of a one-off. You're not treating your partners as research subjects, that they're really partners throughout the process, and that you're laying that out. So a couple of the questions that PCORI is looking to sort of evaluate this piece on are describing how they're identified and engaged. So are you getting good community representation? And are you following some sort of key pieces to engage them and not just have them show up once and send them on their way with a gift card? And that you're developing roles that are really meaningful in your project. So you're not, again, you're not having them come sit on a board to fill a seat, but you're really engaging them. So you might have a community member lead that board as opposed to you as the researcher doing it, but really describing all of those pieces in this engagement plan. And then the other thing that they're really focused on is sustainability. So how, after this engagement award, is this going to be continued? So one, the sustainability beyond the scope of the project. So for example, I brought up our working groups and our network advisory board in my last example. That network advisory board is really designed to be continued beyond the project. So we're using the project to bring that board together, but we're doing it in a way that it should continue for years beyond the project, and provide community representation, stakeholder engagement to our network beyond this 1-2 year project. They're also looking for how are you going to engage patients from this project, but future patients in this health issue that you're looking at. And then are you finding other either financial or infrastructure supports to continue that engagement? So thinking about that sustainability is something that PCORI is really looking for. And then just those dates again, because they're coming up soon. So I'll let you jump in, Sarah.
All right, so the pipeline to proposal awards are smaller than the Eugene Washington Awards, certainly. As you can see here, here's their aim that you guys can read that PCORI wrote for the pipeline, and they're kind of 3 tiers that all build on each other and also increase in award amount. The pipeline goals, again, you can read, are to successfully establish infrastructure, build relationships, and build capacity. And those are kind of the goals for all three tiers. They just build on each other throughout the tiers. So you can see here the kind of idea, I don't know if this has a pointer, but there's the competitive process to get into tier 1. And then everybody who successfully,
The little red
fancy,
button.
thank you, there is a red dot. So competitive process gets you into tier 1. Then everybody who successfully completed the goals of tier 1 can move on to tier 2. There used to be a little competitive process here, but we're now being told that isn't going to happen. So the other kind of little secret with these pipeline awards is they were part of the first group. So PCORI rolled this out as kind of their own little research experiment of their own. And we were the first cycle 1, tier 1, and it just happened here in the West. They're now on cycle 2, tier 1, and cycle 1 is in tier 2. From the awardee perspective, it sometimes appears that PCORI is still figuring out what each tier is going to look like as we're in it. So I'll show you the dates here, but our project successfully completed tier 1. There were 30 people here in the West that were awarded tier 1s. 27 of us moved on to tier 2. As of today, we're being told it will not be a competitive process to go to tier 3, and if we have successfully completed the deliverables of tier 2, we'll move on. Each awardee works with a Pipeline Award Program Office, or the PAPO. Here for the West, for ours, it's the Colorado Foundation for Public Health and Environment, CFPHE, not CDPHE. These are really the people that you interface with constantly and frequently. So there isn't anybody from PCORI that I've ever spoken with. It's all the PAPO, who actually is even kind enough to be here today. They're everywhere. Here's the list of what PCORI says they will do, but they kind of do everything. So they're your contact for everything. They truly, it says here, advocate for the awardee with PCORI. They really are your advocates and your connection. They're incredible to work with. Here, just so you can see who is currently being funded. So here we are, obviously. The blue is cycle 1, as we talked about. So that was just in the West. Those are the 27 of us left. And then cycle 2 now has opened up nationwide, and there are additional PAPOs, which are the gray stars, which are all also posted online on PCORI site if you're interested who the other PAPOs are. There we go. So again, just to give an example, because I think that that's helpful, of our tier 1, taking it a step back, actually, Sara talking about her application reminded me I didn't really speak much to that because I have no idea why we were funded. The application is not like any other grant application ever. It's a lot shorter. From what I have heard subsequently, they're not looking for anything very specific. Remember, the point is to build relationships and develop infrastructure and capacity. And if you already have that and know exactly what you're doing, then you're in the wrong funding mechanism. So my grant application essentially was like, I have absolutely no idea what I'm doing. I have no idea what I'm going to do. And they gave me the awards. They are looking for a topic or a health concern of interest, and mine was preterm birth. I don't know if this helped, but it also, from what I've also subsequently heard, when PCORI initially developed this funding mechanism, they were looking more to fund community and have a more accessible funding mechanism for community members and smaller organizations, and not researchers such as ourselves. And in our original application, I applied with a co-investigator. I have a kid with cerebral palsy, which is most commonly caused by preterm birth. And my co-investigator is a mother who had a preterm birth herself, and her kid spent a long time in the NICU. And we spoke about that in the application, that yes, we're researchers, we're doctors, but this is why we're so interested. So the other interesting thing that I realized in putting this together is it was 2 years ago this month that we were notified of the award. So keeping in mind, this process is not fast. It has been 2 years and we're still not even done with tier 2. long process. So the contract period was initially supposed to be February, got pushed back, which is also a recurring theme. It was a 9-month contract. These were the deliverables, which we successfully accomplished. So the first thing we did actually was make a geomap using state data of all the preterm births in Denver and mapping to where the highest burden of preterm birth was. And it's not shocking where it is. It's also, you can match it with socioeconomic data. So we had our neighborhood target. We then held focus groups with community members of women who had had preterm births from those areas of town. And then we also developed relationships from the focus groups and outside of the focus groups as well with mothers who had had preterm births. Those relationships that were initially built, those women, there are 3 main ones. They are still working with us and work with us very closely. We also then trained them to become patient researchers. And because I'm a chair on COMERB, as Chase mentioned, we made them do human subjects protection training, focus group training, and they actually then co-facilitated the focus groups. So I've never even been to one of our focus groups. Our patient researchers do it. Based on feedback that we got in Tier 1, everybody didn't want to actually care that much about their preterm birth. They just cared more about having healthy pregnancies and health promotion instead of focusing on the negative. So we've now changed our title and our focus, and we're healthy pregnancies instead of just preterm birth. We're now in the 12-month contract. You might also, going back, notice the dates. We ended a year ago. And wait, there was a 3-month lag with no funding and no word, which also is going to happen again. We hear between Tier 2 and Tier 3, and is something really interesting to keep your momentum and your patients engaged. When one of PCORI's fundamental principles is equal compensation for time, and we have no money. These are the deliverables. They're getting a lot longer, and I won't read this all to you, but it's essentially the same as Tier 1, just longer, and again, building on that capacity and further developing those relationships. And I can tell you what we're doing if you're interested, but essentially kind of same but different. And in addition to developing relationships with patients, of course, the way easier part is developing relationships with other researchers and all those other stakeholders that Sarah was mentioning. Even though these funding mechanisms are not for a significant amount of money, I think just by virtue of having a funding mechanism and having momentum about a health concern, other researchers and stakeholders are quick to come to the table. It's the patients and community sometimes that are a bit harder to engage. We don't know what is going to be asked of us in Tier 3 yet, and we're not sure when it will start or what's going to happen. So there's that. And this was really, as Sarah and I talked, an informal session for the few of you here to see what you wanted to hear about. Questions you have or thoughts anyone wants to share? Don't all.
Thanks. I had some experience with Corey. Early on, I was actually an advisor for a specific award. And when they put it out, I think I had the kind of experience you do, kind of research background. And it was kind of strange because views were kind of they were funny. Like came out with, maybe I should have come out completely ignorant, but I had expressed, kind of growing relationships. It was peculiar because I couldn't quite figure out if they knew kind of what they wanted. And I think your description is reassuring. It's kind of a work in progress.
Mm-hmm.
I think their intent is good, but it's always hard to figure out. And sometimes maybe you come out knowing too much and not portraying what they want to see. And I think your discussion was good in terms of the engagement. It's things that we assume they seem to want, kind of in concrete stuff.
And I think a large part of that is because I think there is a difference in how typical researchers think about engagement. And so if you're not explicit about those things, they may assume you fall in one category of sort of typical engagement, unless you let them know how you're thinking about it.
And I think that is the other interesting part about being in the pipeline is that while having the CFPHE to work with because as you're saying, it sometimes appears, at least from our end, to be unclear what PCORI wants or if they know what they want. And that's where that intermediary is incredibly helpful, because they are very clear in their expectations, and it's been very helpful, to say the least.
So it seemed like training.
Does this work anymore?
Okay.
I think we,
Yeah,
I don't know if Chase can, yeah, because I can't remember yeah.
And I don't think I told you about ours, but I can.
Yeah. Did you want to hear the deliverables for the pipeline or for the Eugene Washington? For the pipeline.
Yeah.
Yeah.
But starting with the pipeline, you said training is
Oh.
okay, like human subjects, focus group, so thinking about the research ideas for the CER.
And the training is actually from PCORI that you have to complete. So the training that I mentioned was training we made up. The training that you have to complete is training that PCORI provides. And you have to sit through a webinar or go to a convention or something. We're also incredibly lucky that the PAPO is here in Denver. So there's a convention that everybody has to attend, which lucky for us is in town. So the tier 1 deliverables then, so the training, the monthly reports, I don't know if they're doing those anymore for cycle 2. Those were quite cumbersome. They're usually pretty short and just to ask very direct questions. You know, what have you accomplished? What have been your barriers? Did you do what you say you're going to do? But doing that monthly for this kind of money is a little bit burdensome. And again, then just doing these things are clear. The communication outreach plan and the governance structure were deliverables for both tiers. And honestly, I've struggled with both of them. They give you templates. And again, the PAPO is incredibly helpful in sorting through what does this mean? What do they want? And it's very different for every project. We've also had a very hard time figuring out who our community is. It's every woman who could potentially become pregnant. I mean, it's crazy. And so we've narrowed that down and had a much easier time since kind of figuring out who our community is, but they provide templates for you. So again, that dissemination, like Sarah talked about before, that this isn't helpful if you then don't have a plan to share it back with the community. And that's what that communication outreach plan is for. And the governance structure, we're also still kind of struggling with, but it's how, you know, through these tiers, we've developed now quite a large collaborative. So CDPHE, the State Department of Health, has joined the local health department, Denver Public Health, and obstetricians and researchers here at the university, as well as Denver Health. We also now partner with midwives at MCPN, the Metropolitan Care. We have a payer, Colorado Access. Like, our collaborative has just exploded. And so a document, which again, they provide a template and help you of how we run that, how the patients are involved, who makes decisions, how we make decisions, how we run our show. So the deliverables, again, are very similar for tier 2. Again, the trainings, which they honestly, they never even got together the webinar for us for the training for tier 2, because it's only been, you know, a year since we started, or we're supposed to start. And so attending the convention counted for that. We've changed it now to quarterly reports, which are much more helpful, and monthly phone calls, which are fabulous. Work plan for tier 3. Or a justification for why your collaborative or project is not moving forward in tier 3. And revise the governance document and keep working on that, which we have done. The other big goal of tier 2 is to start narrowing it down, because again, this is supposed to be a pipeline to proposal. And so they want to see that ultimately that you're developing this list of research questions, because it's all nice. We all get together and talk about healthy pregnancies and engaging the community, but we need to start organizing ourselves into a viable list of comparative effectiveness, patient-centered research questions that ultimately the plan, we believe in tier 3, is to then continue to work on that list and start developing the big proposal for PCORI or elsewhere. They're also, I think Sarah mentioned this too, about, you know, looking for other funding. They're very big into that, and to always be looking for other funding mechanisms. Does that answer your question?
I would
Oh.
to your question. I talked to Sarah before she got me. Sounds like a letter of intent, kind of have like all magic special sauce in that 250 words. So I'm writing one, and my population of growing homeless kids. So next step, how does Corey feel about honorary or that thing? They should just come to the table.
Yeah. I think you brought this up briefly about equal compensation. So we're, like I said, we're doing a lot of interviews as the first phase of our Eugene Washington Award, and everybody gets the same amount for participation. So we have some parent advisors, and they get paid more than I do hourly to be a part of our project team. And typically I've seen in other research proposals in terms of like incentives for participations in interviews, focus groups, things like that, where like doctors will get paid a lot more to participate in something like that than a patient, and all of ours get paid the same amount. So we actually bumped the patient compensation up to what we would pay a doctor to participate, because we think that that is important, and Corey agreed with us. So I think compensating people for the time they put into your project is something Corey is really looking for, that you're paying attention to that and that you're valuing the time that people are putting into this sort of work. No, you're compensating them for being a part of your team. And I think that really goes to their sort of partnership principle, that these are partners, not subjects or one-off advisors.
And that sometimes does get awkward, but and we have the same. We don't compensate our patients quite as much, but that is a running theme. But it's the same thing. I'm getting paid to show up to work every day, and we pay them for their time. And it sometimes becomes a very uncomfortable conversation, because at least our women will show up and say, no, like that they really do want to just help, and they're kind and just want to be there. And they get paid very well.
We hear that from people too, like, no, you don't have to. And I think it builds a different kind of partnership with them to say, no, you are here doing work for our project. We're not asking you to volunteer. We value what you're doing.
I imagine studies like this pose a problem for a new issue for IRB.
I do.
I knew it was going to come
Yes,
up.
yes, they do.
So, the IRB here specifically deals with looking at stakeholders and whether they differentiate stakeholders from, say, research subjects or patients.
Do you want to jump in from?
You want to chime in from that?
side?
Because you're talking
I
to
was
the
gonna say,
IRB.
You can chime in from the IRB side, but from the researcher side, I think it depends where you're engaging them and what phase of the research you're in. So for example, we have an IRB application where all of our interviewees are research subjects, because we're conducting basically qualitative research. But then some of our research subjects then switch about halfway through the project and become part of our project team. They complete city training and do human subjects training. So I think part of it is being really clear with the IRB who falls in which category when. So we've done 75 interviews. Those people were all research subjects. But then we recruited some of those people to be parent advisors on our project team. So they are no longer research subjects. And in fact, some of those people are now analyzing data for us. So they are now on our project team list, our personnel for the IRB. We'll also be pulling some of those people into working groups. And so then they also become researchers with us. But sometimes that requires phone calls to the IRB. Sometimes that requires really lengthy descriptions of who's doing what in your IRB application. But I think the biggest thing is just being really clear for yourself and for the IRB about who's a research subject at this point, and are they still a research subject for phase 2 or phase 3 as you move through your project.
And I would.
So I actually am working on it. I use Eugene Washington myself, and it's been really cool for my team. It's just in chair. Just meet with the IRB chair. This is what we've had since taking that initiative. We've had no problem.
Yep. Thank you for saying that. That's essentially because I can speak to it also from both sides, from having been the investigator and the IRB. Like, we're your friends. We're trying to help you. I know it doesn't seem like that, but the IRB's goal is not to be a barrier to research. And that's the main thing. I think this is new and a moving target, and not every project is the same. And it is confusing. And so that's exactly what I would say, is just a phone call, a meeting, and each project I think is slightly different. I think that also keep in mind, I just got back from a national IRB conference because I'm that much of a dork. And on the national scene, there also, nobody has any idea. Every institution is making it up. There aren't any helpful guidelines. Nobody really knows how to handle this. And as well as with the city training, because I felt like that was a barrier. Not all, some of our moms don't speak English, and which is also fun if you ever want to talk about running a meeting in 2 languages simultaneously. And literacy is a huge issue. And so asking your participants to do city training, I think, is cumbersome, which is why we didn't do it. And we created our own, which our IRB was fine with. But there also are, on the city website, they do have kind of a pared down version of city training for exactly this reason that has been developed now in English and Spanish.
Yeah. And I think the other resource we have here on this campus is the CCTSI. They have put together some sort of in-person city trainings or human subjects trainings as well. So there are other options if you have like a group of people or need to do that in a different way than we typically do as researchers. There are resources to make all of those things fall into place.
Also keep in mind, sorry, just last thing, of what the definition of research is. And some of these parts of projects like this, the IRB doesn't actually even need to see. Keeping in mind that if just, what I'm saying, that if you're not actually going to just share the knowledge, if you're not trying to create generalizable knowledge, you're not planning on publishing it, sharing it, if you're truly just building relationships and infrastructure, some of that the IRB doesn't want to see and gets confused when you turn it in.
It gets to be the other end of it. You mentioned publications. And what audience do you find in terms of wanting to hear about, process and lessons learned?
Other than you guys?
Yeah. I don't know if you've had any.
You go first.
So I think it depends what you're trying to publish. If you're trying to publish the results, I think it's the same mechanisms, audiences, journals that you would typically publish to. And then the challenge becomes those difficult discussions about who wants to be an author, who is an author, and co-publishing with your community partners. In terms of methods, I think I'm seeing a lot more interest in that in the last couple of years. That being explicit about, we're doing this patient-centered work, we're working with communities, this is community engaged or community-based participatory research, that I think there's a lot more interest around that. But I don't know that that's sort of trickled up to some of the top tier journals yet.
I deal with the top tier journal and I'm having a hard time cracking that up. Because it's always the control group.
Yep.
A lot of these, you don't get funded to control, funded to learn.
Right.
Share your experiences. I think, like you said, we're having a little bit of breakthrough. But sometimes it's, what the journal's going to benefit.
Well, and I think I'm seeing a lot more interest at conferences in particular, and the more that continues to be showcased at conferences, I think the more the journals will pick up. But the other thing I would say is that just because you're doing community engaged research does not mean that you should be doing less rigorous work. So you should still have those control groups and those RCT methods, even when you're engaging community and other stakeholders throughout the process of sort of decision-making, design, data collection. It shouldn't be making your methods less rigorous.
I think we also haven't tried. I think our we really have been focused on staying true to the intent of the pipeline and building relationships and capacity. What has been interesting is the reverse, is that as people find out that we have done these focus groups and have some data, we've also just, then tier 2, we did a bunch of community interviews. So again, had one of the patient researchers do a lot of community interviews that people want us to publish, share that data again at conferences or not in top tier journals, and I don't want to. And so we're actually having the reverse of that. That's not, I don't feel that we're ready yet until we're ready for the big time. And there doesn't seem to be at a top tier level.
Yeah, that's exactly what I'm facing.
Yeah.
Share your experience and methods.
Right.
It's like a work in progress.
Right. Yeah. Yep. It's very much a work in progress.
Is Corey also looking for deliverables, not just publication, but say newsletters, website, Facebook?
Oh yeah.
Yeah.
Oh yeah.
So that should be.
Oh yeah. They're not very interested in publications.
Yeah, I never got to your first question about deliverables. Some of
yeah.
the things that are in our Eugene Washington Award. So summaries of interview sort of outcomes are one of our outcomes, or deliverables. Having just a list of who's going to be on our network advisory board, having that sort of roster for them. Minutes from our working group meetings is a deliverable. And then you mentioned sort of your reporting mechanisms for the pipeline. Ours are biannual, so every 6 months.
More money, less reporting.
More money, less reporting. And again, they give us a template that's pretty straightforward about what they're looking for at the PCORI level. And then we have monthly phone calls with our project officer at the National PCORI office, which are mostly just them offering help. How are things going? What can we do to support your engagement efforts? How are you coming on the deliverables? I'm trying to think what else is in and then our deliverables at the end of the project are research questions and draft aims from each working group.
Something that I just thought of that it hasn't been useful for publications, but having now developed this patient advisory committee or a group of women that work with us, I truly believe in this, and we work with them now on other projects and write them into other grants, which I think has been looked upon favorably. And so we now just have a much larger grant through a different funding mechanism to implement a different program. And it's the other co-PI and I sit around, we're like, well, should we do this? Should we do that? Should we do this? Finally, I'm like, well, we don't know. Like we're the investigators. We have no idea what we're talking about. And we're actually meeting with our patient advisory committee in a couple of weeks, and we have this giant long list of when, where, what, who, all of our main questions, and we're really relying heavily on this advisory board that we've developed through this. So even if we don't continue down the pipeline, or I think it has been helpful in other aspects of our work, but not in a traditional sense.
Mm-hmm.
Any other burning questions?
Technical, logistical question.
Exactly. Cool. Megan, did you have anything to add from CFPHE?
Thanks very much.
Thank you.